Hey everybody, this is Travis Robbins and Nick Horowski. We work at Robbins Rehabilitation, which is a physical therapy clinic in Lehigh Valley, but today we're talking about the physical resilience outlook. Nick, we have been working on this for well over 2 years now. But there are some people that don't know about this. If you're on our email list, you're our patients, you've been involved in the study that we've been doing, you definitely know about it. But for someone who's coming across this for the first time, what is the physical resilience outlook and why did we start working on it?
So it's a series of 10 different physical tests, right? Like as it sounds like physical outlook, right? And it's really to see how well physically you're going to age, right? Like trying to look at a bunch of different aspects of strength, balance, just range of motion, and hopefully to see how that's going to test how you do from whatever decade you're in and progressing forward.
Okay, so the idea is if I do well in all of these tests, it should predict my ability to age successfully. Yes?
That is the goal, absolutely.
Okay, let's talk about aging successfully because that could mean a lot of different things to a lot of different people. At the beginning of this, when we were trying to figure out, okay, we had this out to, over 20 tests easily, probably closer to 30. And we're like, how do we kind of narrow this down to the minimum effective dose? That's what we're always looking for. Because if you can accomplish something with the minimal amount of investment, which kind of sounds crooked, it sounds like, well, if I could just be like super lazy and get the most out of it, that's the way to go. But it's not. It's really, there's so much stuff that we could have put into this test. How do we boil it down to the most important things? And I think really to me, what helped guide us to the 10 tests we got was asking people what they want to do on their 100th birthday because we can make a plan for that. If we don't have any goals or target, then it's hard to make a plan to get somewhere. How the first question people are probably going to ask, or one of the first questions is, how did you kind of get it down to these 10 tests? Why did you pick these 10 tests?
It's right. It's trial and error. Some of it, right, is like trying to see like what is the most, here's the minimum effective dose too. Is like how can we get it down to those things, right? So it's making sure that we're taking the lower extremity into play, the upper extremities, right? But then looking at all different types of physical health, right? So sometimes it's endurance, sometimes it's strength, right? Sometimes it's agility and power, and all of these are different components. So trying to pick a little bit of each of those for the flexibility, the range of motion, right? Like each of those for like each joint movement, muscle of the body, trying to make sure that really everything is incorporated in some way.
So when we talked to people, we saw some commonalities in the answers that they gave us. We say, "What do you want to be able to do when you're 100?" Like, "Oh, I just want to be able to like get out of my bed in the morning." Like, okay, let's refine that a little bit. When Nick and I go and do these talks for for groups of people, the first question we always ask is, "Who wants to live to be 100?" And very few people raise their hand. It still surprises me to this day. But like in a room, I most recently did it in a room of probably like 45 people, and maybe five of them raised their hands. And I said, okay, all you like don't want to live to be 100. Why not? I started asking those questions, and really, what do most people say, Nick?
Because they just don't think that they're going to be able to do what they want to do when they're that age, whatever that might look like.
Yeah. So they think about, okay, I've seen people that are 100. I've had people in my family that are close to that, or maybe they didn't get to that, but they got to like their 90s, and man, that did not look like a ton of fun. Like they could not do the things that they wanted to do. So I don't even want to get there. So let's kind of re-engineer that and to be like, okay, what is the plan we need to put together so that you can do the things that you want to do when you're 100? So in these talks, the next question we ask right after that is, okay, let's ask a different question. If you have the same or similar function that you have today when you're 100 years old, how many people want to live to be 100? And of course, majority of people raise their hand. Okay, so that's kind of when we think about the tests that we came up with, I think that's a large part of the basis of how we selected these tests. But we did ask people what they want to do. So Nick, I'll put you on the spot. What do you want to be able to do when you're 100 years old on your 100th birthday?
I think it's got to be hiking to the top of the mountain at this point. That's a lot of what I do with friends is get out on hikes, right? So I think that that is one that's going to both push me, test me physically enough to kind of scratch that itch at that point.
Okay, let's get more granular here. How long of a hike do you want to be able to go on, either time or distance? Hike is a little bit tricky because it's not like, well, I want to go on a 1 mile run on a flat surface. It's a little bit different. So time or distance that you want to be able to do.
let's call it a 4 hour hike.
Okay, 4 hour hike. So it doesn't, we're not trying to set the record for, fastest hike on that. Just trying to be able to go for a 4 hour hike. Well,
Yeah.
I'm going to argue that if on your 100th birthday you want to be able to go on a 4 hour hike, geez, when you're like 80, 70, 60, you better be able to go on a 5, 6, 7, 8 hour hike so
Have
that you,
something in reserve. Yeah.
yeah, exactly. So you're not you don't want to prepare for a decline. That's what our patients say all the time. Well, I'm getting older. I'm supposed to have back pain and stop doing the things I wanted to do. And it's like, no, sometimes it's a little bit harder to do those things, but if you invest the time and effort into it, those things certainly are achievable because we see them in other people. It's not like we're saying something that's impossible. There's 100-year-old people that run a marathon. I'm not personally interested in running a marathon, but it's physically possible. So you have to kind of set your goals for that. So I was setting up our new school platform, and the first question in there is, what are 1 to 3 things you want to be able to do when you're 100? So I said I wanted to be able to go on a 2 mile kettlebell hike. So that's a whole nother podcast, but that's something Nick and I have been playing around with. I want to be able to go down a green trail on a snowboard. So if I want to be able to go on a green trail, I'm 100, I better be able to go down like at least a couple blues when I'm like 70, 80, 90, that kind of stuff. So just having that in mind is really important because I have to prepare for that and make a plan for that. So now we've decided like these are the tests. We did that based on what a lot of people were telling us. A lot of people said they wanted to travel. I also put in there I want to travel to Japan. It might seem for my 40s-year-old self, it might not seem like too big of a deal, but if I want to be able to do that when I'm 100, I have to do some things in preparation for that that might not seem straightforward, but we're kind of setting up plans in order to do that. So take the test, you get a score, and then we put together programming. So we say programming because when we say exercises, people kind of like don't love exercise. They have the idea of like pain and sweating and that kind of stuff. And for the most part, the stuff that we have you do is not too much involved with the heavy pain and sweating stuff. It's more mastering movement. So we've researched this, right? So we went to DeSales, and for the last, I mean, almost 2 years we've been working on that research project. We just finished it. It's getting published soon. The kids in the research program just gave their poster presentation, so you can find that wherever you're watching this, which is really cool. And we proved that the testing is reliable. So really quickly, Nick, what is reliability? What is it? Why is it important to have reliability for any test that you're going to do?
So reliability is showing you that something is consistent amongst people, like when you're measuring it.
Yeah, so we measure like one of the things is that we do is let's pick one. So
Yeah.
farmer's carry. So you should be able to handle half of your body weight in each hand and be able to walk that for 100 yards or a football field. Okay, so when we measure that, that might seem like a thing like, well, why need reliability there? But you have to be able to measure that consistently. If I watch someone do that and Nick watched someone do that, we would get a very similar score. The reliability was very close on all the tests that we did. So it just means that don't overthink it. It's a reliable test. If I have someone do the test, then we can rely that there is a accuracy in the test, and that's kind of the
No,
beginning.
that's validity.
Yeah. So, well, accuracy. So, does the test really do what you want it to do? That's validity. So,
Yes.
validity, yeah, for us would be the next step, and as we continue the research, is like, okay, for the scoring system, you get a 0 to 10. There's 10 movements, you can get 100 on the test. That's a perfect score. No one's ever done it. If we do it, believe me, you're going to be on the front page of the website. But no one has ever done that. We've tested people. We've tested collegiate athletes and high school athletes. We've tested people all the way up into their 80s. No one has ever been able to get to 100. But your score gives you an idea of where you're weakest and where you need to kind of improve. You can score either 0 to 3, 4 to 7, or 8 and above on each of these tests. And depending on your score, you're going to get programming. You're going to get kind of homework in order to improve on that. And then now we need to study, okay, if we give you homework, again, minimum effective dose, we can't give you probably 30 exercises to do and expect people to comply with that. Does your score improve? That's kind of the next thing that we're looking at, and then the next stage of this whole process. But when you think back over the last couple years, like what has been the most fun for you developing this tool?
As far as I think, Travis, it's some of the surprise actually for people, right? I like opening people's eyes, I guess I would say, right? To uh being able to show them and help them understand um how much goes into actually that physical aging well, right? So that, hey, why again, with going to the question, well, if you could age to 100 and, or excuse me, if you could physically be doing what you want at 100, right? Well, that's what it is like showing people what that looks like and kind of letting it's that aha moment of for them of, oh, this is what I actually need to be able to do.
Yeah, I think I remember back to there's people mostly around my age and a little bit older, maybe like, 45 to 65, they're doing the test, and it's things that they probably haven't done in a long time. Even people that are younger, I would imagine not many people have tested their vertical jump recently, just seeing how far they can get off the ground. So people think, oh yeah, or even they might know, like I know I used to have a high vertical jump when I was in college and I played football, and so did you, and it's not as high as it used to be, and that's a reflection of power. But when you get people that haven't jumped in a very long time, they are very startled by the fact that they cannot do those things. And bar hang is another common one. I had this one subject that was in the study, and he was a college football player a long time ago, and he was probably in his mid 60s. And it's, oh, bar hang, that's easy. And this guy had not, I sometimes ask people, when's the last time you hung at a bar for as long as you can? And most people don't do that. That's not in their normal movement during the day. But he said, oh, this will be easy. And he could only hold on to the bar for about 5 seconds. And he was blown away. He was like, what? Well, what does that mean? He's asking me all these questions. And then he did pour down some of the other tests. And like, after he took that test for like 2 weeks straight, he would text me every day and told me all the things that he was doing because he realized this is something I should be able to do. And if I
It's a
cannot
big
do this,
motivator.
yeah, if I cannot do this, I'm probably not going to be able to do the things I want to do that I wrote down on that piece of paper and handed that physical therapist at the office because I know I need to be good at these things in order to do that. I need to make some changes in my life. So to go back to the point you made a couple minutes ago, I think it's the best part is watching the eye-opening experience that people have of like, wow, I thought I would just be good at that. But if you don't do something for a very long time, then you're not going to be doing well at it. So now, as we talked about kind of the next stage of what we're doing in terms of working on the scoring and improving that, what are you looking forward to over the next couple of years in developing this program?
Results. I think it's like having that same guy test 6 months, a year later, and seeing improvements in all those categories. Like whether it's he got a 2 on all the categories and now he's scoring a 5, or maybe he was getting an 8 on a couple but zeros on others. And it's like not only is he getting maybe to a 9 on that one, but now he's up to a 3, a 4 instead of the 0. So I think it's just that being able to see the progress for everybody that's testing it out.
Okay. So one of the first things that we do when we introduce this to somebody is like, hey, here are the 10 tests. There's a quick video that you're going to be able to see no matter you see this. And it's like, this is what a bar hang is. This is what our agility test looks like. This is what our push-up test looks like. And people look at that and say, I don't need to do that. That's for like athletes and stuff. I think I'm fine. Like, what is the messaging that you would tell that person? Because I know you've heard that before because we all have. What do you tell that person in terms of if you don't do this stuff? You're probably not going to get the outcomes that you want when you get older.
Yeah, I think that's more of an individualized thing because then I'm trying to find like what is that motivator for them, right? So maybe it's maybe it is grandkids, right? Maybe it is hiking up a mountain. Maybe it is I don't want to end up like my parents or my grandparents or so it's kind of starting to know what that motivator is for them to show them like, okay, well, you've already talked to me. Like, remember how you said like your grandfather, like he really couldn't get out of the chair like at a certain point. It's like, do you want to be able to do that? And then it's like, oh, yeah, I forgot about that. Like those are just finding what are those things for you that you just assume are maybe easy, but it's like look at some of the people around you, certain loved ones, whoever it might be, and see what are the things that you want to make sure that don't happen to you.
Yeah, I would say it just as a result of the field that we work in, as you age, I mean, Nick and I have been doing this long enough where we've seen people go from their, 50s and 60s to their 60s, 70s, 80s, and without a plan, it doesn't go well. And even if you're in physical therapy and we have the opportunity to educate you 3 hours a week, sometimes it doesn't go super well, and it's usually a physical issue. Like a lot of people are like, look, man, I'm gonna die. I'm not going to die of a back injury. I'm going to die of cancer, cardiovascular disease. I'm going to die of like what people say, old age, metabolic disease. That's a whole like set of podcasts. But tell someone that's listening now, your decline as you get older almost always is going to be something orthopedic, something physical, something to do with your joints, muscles, connective tissue, because that's what we see. How do we get them to understand that if you want to do the things that you want to do when you get older, it's an orthopedic issue that you have to work on?
Well, let's use the cardiovascular disease because that's a perfect one, right? It's like, well, yes, we could talk diet, but we can also talk of just the lack of movement, right? So it's like, well, now when you're not moving, your heart is not pumping properly. Like it just goes down to so much like if you cannot physically exert yourself, build up the VO2 max, and then we could look at the VO2 max testing and all of the cardiovascular papers that have come out about VO2 max testing. I mean, I'm sure it's in the tens of thousands, just with how much research is on that. So it's like when you look at that, now you can see, right? It's a heart issue, right? Yeah, I'm going to say just directly for easier discussion of it, but it's because of a lack of physical use of the heart. Like you're not training it the way that you should throughout with the rest of the musculature. So really, it comes down to, well, it really is a physical problem, an orthopedic problem, as well as the cardiovascular issue.
I think a lot of people are like, well, when I get older, if I'm going to live longer, it's going to be like medicine to decrease my cholesterol or blood pressure or, some kind of preventative stuff for like cancer or something like that. Whereas because we see it firsthand, I'm going to tell you, it's probably not going to be that. I mean, sadly, there are people that, drop dead of a heart attack or get cancer. There's, to some extent, there's not a ton that you can do physically to prevent that. The cardiovascular side, yes, and some of the cancer side, yes, maybe, but that's, not as simple a conversation as you need to get your heart rate up consistently, weekly, and if you're not doing that, bad things are going to happen. And if you do that, if you can figure out the exercise part of it, that is going to be more powerful than any kind of diet, drug, like any kind of medication that you think is going to get you to live longer. Because it's not just about living longer. Yes, humans are living longer, but I would argue, I don't know that we're living much better when it gets to like 65, 70, 75. So that's the problem that we're trying to tackle. And we really think that if you take the test and you get awareness around the things that you're not good at and you work on that, then you're going to be able to do the things that you want to do when you're 100. Would you agree with that, Nick?
Absolutely. Yeah, it's a very simple equation there.
Yeah, it's almost too simple to explain it to people, and I think it's got to be more complicated. And everybody
It's
starts
not a
at a different,
trick, right? It's not a trick.
yeah, and everybody starts at a different, time and position. Like we have patients that come
Yes.
in that take the test and they're 70. So they're like, is there really anything I can do right now? Yes, there is things that you can do. Now we have people that come in their 30s and 40s and they want to kind of prepare for that because this longevity stuff is getting a little bit more popular in terms of mainstream type stuff. So people are investigating that a little bit more. It doesn't matter where you start. It's just like investing. It's always better to start earlier, but it's never too late to start. And anybody that kind of gets some awareness around what their score is, how to improve it, anybody that we run through the program has had great things to say about how it has affected their function, their ability to do things as they get older. And now they're excited about getting to their 100th birthday versus the people in the beginning when we talked about this, when we said how many people want to get to their 100th birthday, they're not very excited about that. It kind of changes the mindset around that. So if you're watching this, if you keep going wherever you're watching this, you'll find more information about the test, how to take it. If you want to take it in our offices, you'll find information there. And we look forward to seeing you guys here in this platform and in our office, and looking forward to getting you to want to look forward to your 100th birthday.